to make kids stop using, but I do want to make sure that their using isn't harmful to them, it isn't harmful to their kids, and that we have a plan for safety for both them and their kids. So, but oftentimes kids who are involved as teen parents have had some sort of history around this, or they've had history in their family. If you look at some of the research around children of alcoholics or children of people who are chemically dependent, you know that they often very much are sort of looking for approval, and they're seeking sort of almost that people-pleasing thing. So they are going to be willing to sort of take some risks in order to get someone to like them, or to get somebody to do what they, you know, to have that emotional connection. I also think if you're growing up in a family where there's drug and alcohol use, there is sort of this sense that I think the way they use it, even phrase it, is it's just as easy to lie as to tell the truth. So for these kids kind of coming into kind of these systems where they very much feel like adults are really have a big stake over their lives, they may not feel comfortable sort of telling the truth unless you really, really lay a groundwork where, you know, it's really much safer and better to kind of tell the truth about things. And we don't actually set that up, especially in our housing programs. You know, there's a lot of housing programs where if a kid is using, they are going to get kicked out. So far better for them, and logical to them, to use off-site when they're hanging out with their friends and maybe try and not come back when they're high, so that instead they get dinged for not coming back as opposed to getting dinged for something that will get them kicked out. So, you know, just think about kind of how the policies and procedures we set up might even be setting up the kids to fail. I talked about lack of knowledge about sex or contraception. And I know it sounds like such a cliche, but seriously, I mean, I think being comfortable yourself with having those honest, frank conversations, because I would say probably 50% of the teen parents I've worked with who have had babies, so they really should understand where they came from, really don't understand. And they certainly don't understand what they need to do